It's a very exciting time at Pharmac on quite a number of fronts. One of them is that the reason people work at Pharmac is that they like buying medicines for people, and with recent budget uplifts, first of all filling in the fiscal hole at budget 24 to the tune of $1.776 billion, and subsequently adding $604 million. We now see budgets of around $1.6 billion a year, around $500 million or nearly a third higher than the trend several years ago. That amount of money means that there's been a flurry of activity at Pharmac as people have sought to use the money to buy the pharmaceuticals that New Zealanders deserve and that they've been promised. And that's led to further work, for example, ensuring that we can get the administration of those medicines done efficiently. It's been generally an exciting time for people who work at Pharmac and for people at patients, and I've been really appreciative of how people at Pharmac have responded to the challenge. They have stood up and said, right, we've got a job to do. We're going to have to up our work rate. They've done it, and you've seen continuous announcements of new medicines being available to New Zealanders. There's also a few other pieces of work going on. In my letter of expectations, I said that I hoped that Pharmac's culture would evolve away from being perhaps perceived as an adversarial organisation, and I don't blame Pharmac for that. Their job was to save money for taxpayers, say no when they had to, and to go toe-to-toe with pharmaceutical companies to get a better deal. But that has meant that they've sometimes come across or been perceived as quite an adversarial organisation. However, I think our new chair, Paula Bennett, and our chief executive have taken up the challenge of improving the culture right across Pharmac, and we're seeing increasingly better consultation, more acknowledgement of patient voice, and more collaboration with clinicians and providers. And that's been really visible in recent summits that we've held, where people have said that for the first time they felt, in their experience at least, they felt like Pharmac was really there to have a dialogue. There's also an ongoing challenge around who in the New Zealand healthcare system manages devices. Since 2012, Pharmac have nominally been responsible for purchasing and procuring medical devices. To this day, even 12 years later, there's still a split between Health New Zealand and Pharmac in terms of who actually does that. However, there's a current review being undertaken, and I expect, as again in my letter of expectations, that one way or another we're going to get much greater clarity around whether Pharmac is all in or all out of medical devices, a decision that successive governments over the past 12 years haven't managed to make decisively. So those are a few of the areas where Pharmac has been working and operating at a big picture level. I think one area that I expect people will want to ask about is the change from estradiol to Mylan patches, and this has led to considerable outcry from within the community and from prescribers. Though it has to be said, not all. There are some people who are pleased with the change, and we should remember that different patients have different preferences. What's clear is that many patients receiving HRT are not happy with the proposed change to Mylan, and for that reason, I've written to Pharmac and said, well, you know, I recognise that this process started some time ago. I believe it started last June, before the current government was in place, certainly before I was the minister and before Pharmac received my letter of expectations. However, the outcome is now with the patients, and it's them that we have to think about. So I've asked them to consider carefully whether or not the level of patient voice was involved in this decision. And I've heard back from the chair just in the last few hours actually saying, well, actually, yes, we are going to take another look at the role of patient voice in getting to this decision. That doesn't mean it will change, because I can't promise that Pharmac will change its decision. What it does mean is that the new culture that we're instilling in Pharmac will be retrospectively applied to the decision around estradiol and Mylan for all of those women who are concerned about the supply of hormone replacement therapy. So those are some of the issues that I thought might be worth drawing your attention to, but obviously you'll have your own questions and looking forward to answering them.
So the annual report records a surplus of $242 million in the year under review. And I'd like to confirm that your understanding is that is due to much more money being transferred to Pharmac for the purposes of purchasing COVID vaccines and therapeutics than was actually required for that purpose.
Yes, that's correct. I think it's 284.88 million, and that reflects the transfer of COVID-19 vaccine and treatments purchase funding into the CBP.
It's a considerable, in the context of Pharmac's overall budget, it's a considerable amount. Were you aware of this earlier this year, that the result would be so favourable when you were taking decisions about the budget for the current financial year?
No, obviously these are things that Pharmac has to decide for itself. I don't get involved in their operations.
Well, you made some statements about there being a fiscal cliff at Pharmac. Are you a little bit embarrassed now that you find out there was $240 million sitting right under your nose?
Well, no, because it wasn't under my nose. The relevant decisions had been made at that point. But second of all...
Well, it's not decisions, it's the amount of money sitting in Pharmac.
Well, it depends on how much money is spent, and that is a result of a decision to acquire something or not. Now, that money is now available, that's true. But I mean, you know, with respect, if you come to talk about embarrassment, you know, if you're seriously saying that 248 or $284 million makes up for $1,776 million, which is the $1.776 billion fiscal hole you left us with, well, you know, 284, 1776, I mean, those aren't comparable numbers, right?
Well, I think...
All right, we've done our lot here. Ruhana.
Point of order, Mr. Chair. Just
point of order, Glenn Bennett.
I know I'm not normally on this committee, but normally in these spaces there's a line of questioning we're able to go through.
Yeah.
And I feel like we've only just started that line of questioning.
Thank you for the point there, Mr. Bennett, but I was quite clear at the start that we would have a primary and then two supplementaries.
So we're just going to not explore $242 million.
Mr. Bennett is perfectly capable of also taking another question, as are you, Dr. Verrill.
Speaking of point of order.
Look, I don't want to interrupt, and I certainly don't want to undermine the chair in any way, but I got to tell you, Napoleon actually had a saying for times like this.
Awesome.
I think he's well, if I may, Mr. Chair.
Well, no. My comment was that I was going to pass it on to Ruhana.
Can I speak to the point of order, Mr. Chair? This is scrutiny week, and as we had earlier in the year, and the other committees I've been on, there was leeway to actually obviously prosecute and delve into some of these things. It is a period of time we need to explore this, and obviously opposition, we need space to do this. So
yeah, I'm not going to keep going over this. You've raised it twice now, and I've laid it out clearly right at the start of this that this is how we would.
And who set those rules? You did.
I did. I said it right at the start of this session. That we would have one primary and then two supplementaries. Well, look, it's to give everyone an opportunity. We have a 30-minute hearing here with the Minister.
I mean, if you don't mind me saying, mate, the great irony is you're taking away your ability to ask me questions. Can we get to another question?
I just wanted to clarify that, so thank you.
We're going to Ruhana Linden. Thank you.
If I can start on the previous members' questions in terms of what is the plan around the surplus that exists. This isn't my primary. I just wanted to sup on that because we were just getting into the corridor. So what is the plan from here in terms of the surplus that we have?
Well, I'll invite the Chief Executive to address that.
So the 284 million was the last of the advanced purchase agreements around the COVID vaccine. It was specifically payment for Novavax. We're currently in a dispute with the company and having discussions around that payment. If that money is not spent on the Novavax, it will be returned to the Crown. It's not money for the CPB for other medicines funding. It was a separate pool that was specifically around the last of the advanced purchase agreements for COVID vaccine.
So can I go on to my primary? Thank you.
You have 3 questions in total, so you've used us up. So you've got 2 left. That's how we're going to do it, okay?
Yeah. Okay. So Te Rautaki Whaioranga is our Māori strategy for Whāmek, established in 2022. I'm really interested to hear from the Minister in terms of the board's decision to disestablish Te Rōpū Māori, considering patient voice is so important. And from your perspective, in terms of what does engagement look like now, beyond having that rōpū, and I believe there's going to be an outreach to iwi Māori partnership boards and others. What's your expectation for that?
Well, my expectation for Whāmek is to listen to and hear the voices of all New Zealanders.
And so in terms of engagement with Māori, what would that look like for you?
It would look exactly the same as engaging with every other New Zealander. We treat people first as human beings. We try not to make assumptions about people based on their background. If I meet a person, I take them as they are and look at the person in front of me. I don't try and make any kind of prejudicial assumption about how they should be treated. And I wouldn't expect Whāmek to do that either.
So is it the position of the Minister that Te Rautaki Whaioranga is redundant now? Is it still a priority for the organisation?
Well, the priority for the organisation is to treat every patient with the respect and dignity that they're due.
You have a specific strategy for Māori health, though.
I'll ask that you bring the questions through the chair. I laid that out at the start as well. On this line of questioning, I did generously give you the one and then the two sups after that, even though you had a sup on the other one. We've gone through all of those. Debbie Nato-Apaka.
Thank you, Chair. Tēnā koe te minita. My question is primary. Why has the Minister directed Whāmek to stop factoring Te Tiriti o Waitangi into its decisions? How do you anticipate removing Te Tiriti o Waitangi from Whāmek's work program will impact on Māori access to medicine?
I don't anticipate it would have any effects. In fact, it will probably be enhanced because Whāmek will be focused on using the best possible procedures, the best economics, the best pharmacology to get the patients the medicines and the technologies that they need. And I think if Whāmek is doing its job better, that's going to be for all New Zealanders, and of course that would include Māori.
Follow up on, so what proportion of the estimated 175,000 people who would benefit from, I think, the 604 million Whāmek funding boost in the first 12 months period are Māori?
I don't have that information in front of me, but no doubt a portion will be, and there will be reasons for why that portion is there. For example, I suspect what you might find is that people generally develop cancers when they're older. Some people develop cancer when they're young, and of course it's a tragedy that you're at any age, but particularly when you're younger. And the Māori population on average is younger. So, for example, you might expect less expenditure given the level of cancer drug investment for Māori. However, it's also important to take a longer view, is that those people who are younger today will be older in the future, and that's when their cancer risk will increase. So I always caution people to be very cautious in how they use their statistics. I always caution people against using, I guess, really coarse blanket ancestry-based groupings of people, because it actually diminishes your understanding of who you're dealing with. I think it's important to use really good statistics, and you'll see that in the government's overall approach. The circular on need not race is designed to ensure that we're using robust statistical analysis to get to the heart of human need rather than grouping people.
But noting that you actually don't know the percentage of Māori that are going to be impacted by this boost of funding, I guess through the chair, the next question is, it's noted that the appropriations omit equity-based investments. So how is Whāmek's current decision-making framework prioritising health equity for Māori? I'm noting that you don't acknowledge they need to be acknowledged. And are there plans to introduce new equity-based criteria in future funding decisions for Māori?
Well, if you look at what Whāmek's set up to do, it's actually to help people who are sick, where medication can help people secure better health outcomes. Now, the formula that they use does not discriminate based on people's background or ancestry.
Equity through the chair was the question I wasn't asking about background or ethnicity, it was equity.
Well, again, it's designed to target people based on their need, based on whether or not they're in a position that they can benefit from medication. Now, if you're not sick, then you are going to get less from Pharmac. But here's the good thing, you're not sick. I would have thought that that was a pretty good thing. So I don't know what you mean by equity or why you think equity is relevant here.
Just to clarify for the chair.
What I do know is that Pharmac is set up to help people who can benefit from medicines. And to be honest, I'd rather not be someone that needed to benefit from medicines if I could
Absolutely,
help.
and I'd rather that we didn't have equity-based questions, but if I can just clarify, because there wasn't an answer, and we have got limited time. What the minister's saying is that you don't have equity-based investment for Māori, or you don't recognise that Māori have.
We'll keep going over this.
I've addressed your question, and I can talk it through
No,
for you
this is
more slowly
shallow
another time,
scrutiny.
perhaps.
This
We've
is shallow
got
scrutiny.
I completely.
And we're going to, look, I was quite clear on how we'd
You were
approach
clear,
this.
but
You
it's
got your
still
primary
shallow
and a couple
scrutiny.
of
You're allowed to
supplementaries.
state that.
Just because you didn't get the answer.
Mr.
Can you
Chair.
please be quiet when the chair is speaking? We need some order in this place, all right? Or it's not going to work properly. Just because you didn't get the answer you want doesn't mean that you have the right to just talk over the top of everyone else.
We also didn't get
We
the
will now
chance
move to
question.
Jenny Marcroft,
Thank you, Mr.
followed
Chair.
by Carlos
There was
Jones.
a sup on this
I
side,
was
Mr.
supping.
Chair.
Well, we've already had a primary and 3 subs, and we've got other members here who haven't had an opportunity yet.
Point of order, Mr. Chair. In terms of the role of Scrutiny Week in looking at standing orders, obviously it's around holding the executive to account, and it's a chance to I guess, for confidence for the public to understand that. I was looking through Standing Order 33A, which reflects on, and I've just noticed, I mean, I know it's not a standing order, but it's a convention of this parliament for many, many years. It generally, opposition gets 60% at least of questions, and it easily, you can do your numbers on your bit of paper, but in terms of the time that was spent, I don't feel that was actually fair, and I just want to, I guess, make that really clear.
We're still live here, Mr. Bennett, and I do have the numbers here and we can discuss them afterwards, but I think we've had a pretty fair shot at it. You might not have gotten the answers you want. I appreciate your point of order.
But also looking
Thank
at
you.
what standing orders actually
But
say.
I will
Still read standing
leave
orders.
this now and we will move out of public committee and we can go from there back to our consideration.